What if you're leaning as a no on this, but all of a sudden you had to vote one way or the other? Are you still a no? When I talked to Phil Gramm, the former Texas congressman, of course, was very instrumental in getting the Reagan tax cuts through. Sometimes there is a benefit with forcing a vote and getting people on record. You said something interesting during the break, that sometimes the numbers don't look good, but if you wait for the numbers to look right, you'd be waiting a long time.
Well, let me give you an example. The day before we voted on the reconciliation bill for the Reagan program, that called for the tax cut, it eliminated 3 Social Security benefits. It was a tough vote. 30 Republicans are uncommitted. Reagan calls them down to the White House. We're all sitting around the cabinet table. And by the time we got around the table back to me, almost everybody was with Reagan. It was just their constituents. So Reagan sat there, and he didn't say a word for it seemed like 5 minutes. And then he looked at everybody and said, you know, I was confused. I thought this was about country. I didn't know it was about constituency. And he got up, left. He got up and left. That was the end of the meeting.
How did the vote go?
The next night, we called a roll. We won by 1 vote.
Interesting. So maybe there's a lesson here that if the leadership is waiting to get the votes, that maybe if they hold the vote, they'll have the votes. And that's what happened. They had the votes, but it didn't look that way going into it. Freedom Caucus member, Congressman Louie Gohmert of Texas, joining us right now. Congressman, what do you think of that? Go ahead, do the vote, and yay or nay, see how it goes.
I was thinking we should have done a vote last week, because think about it. I mean, the Freedom Caucus, there may be one now that's a no, but we've been yes for at least a couple of weeks or so. And I was thinking we could have had the vote just like Phil Gramm and you were talking about, because think about it. You have got people that are part of the moderates who have voted over and over and over to repeal Obamacare, and repeal so much more than the current bill does. How do you tell your constituents, I voted over and over and over to repeal Obamacare when it didn't count, but now that it counts, I am not going to keep my promise and vote to repeal even part of Obamacare? I think that's a tough thing to sell back home, and that's why I think if we just went ahead and had the vote, that we would get there. We would have at least 218.
You need 216, again, depending on who's there and who's going to be there for the vote. Let me ask you, though, Congressman. Right now, it looks like former no votes, Fred Upton of Michigan and Billy Long, are right now going to be possibly yes votes, that they were won over with this new provision on, I guess, pre-existing conditions that's more amenable to them. It looks like leaning with them are Michael Burgess of your fine state and Greg Walden of Oregon. So let's say all 4 end up being yes votes from guaranteed almost no votes. How does that change it among caucus members who might just say, well, anything that makes them happy makes me unhappy? Because it's always this, what you do for one side ticks off the other side. I mean, how do you think that affects the math?
Well, you know, I know I'll never be in leadership. I've made too many people mad, but if I were, I would say, okay, well, then you've got a choice. We're either going to vote this, or we're bringing a full repeal bill to the floor, and you're going to either vote on one or the other. Otherwise, you're telling your constituents I was lying year after year after year when I said I wanted to repeal it, I would vote to repeal it. So you tell us, do you want us to bring the full repeal to the floor, or do you want us to bring this one that repeals some of it? You make the call. I mean, and the problem I had originally was it really didn't repeal anything about Obamacare. It was going to give more power to the Health and Human Services, hoping that we could do administratively.
Well, this gives more power to the states, but some of the moderates tend to worry that in so doing, it jeopardizes coverage for pre-existing conditions and all of that. Now, let's say they've sorted that out. You know this better than I. The president is saying, look, whatever we have here is better than what we have now. That the Obamacare is so bad that almost anything we come up with will be better. Do you agree with that? Because that apparently is the pitch he was making and is making.
I didn't agree with that originally because it actually gave more power to Health and Human Services, which was a step in the wrong direction. But the changes that President Trump was readily willing to agree on, we had an agreement twice when our Republican leadership in Congress wouldn't go along, and he had to back up. But no, I think originally it was not better than what we had, but now it is.
You're going to vote yay on this, right? All right. So
yes,
when is the vote coming? Is it going to be tomorrow? Are you hearing it tomorrow?
See, that's what I was saying, Neil. I thought we should have voted last week because I think some people that have been hesitant to be yes would have a hard time explaining to their constituents how you could vote for full repeal dozens of times.
Do you think it's tomorrow? You're hearing a vote will be tomorrow?
I've given up trying to predict what our current leadership will do, but I think it is the smart thing to do because if we don't, the House isn't in session next week, and it will be a terrible mistake for people to go home, and we haven't even done this. Yeah. This needs to be a win. We need to put it in the win column and move on.
You guys are taking another 2-week vacation. What is the deal with you guys?
No, and I keep telling my friends like Sean that actually you don't want us in session every day. We pass more laws every day that infringe on your freedom.
We don't have to worry about it. We don't, because apparently you're not.
Not if we're not voting for something meaningful. This is meaningful. This will make a difference in people's lives, bring down premiums. We just need to take the vote and do it, and I think it passes as soon as we do.
Okay. We'll watch closely. Good seeing you again, Congressman. Thank you.
Great to see you, too. Thanks, Neil.